Adenoids and tonsils. All the children have adenoids and tonsils. Now, adenoids and tonsils are given at the entrance of our respiratory and gastrointestinal tract. Now, they are essentially there to guard the entry into the respiratory tract or the gastrointestinal tract. Now, they are policemen, they are the watchmen that stay at the entrance and keep destroying every harmful thing that enters our body. Now, they can be of different size in different children. In children where they enlarge and become big, they cause problems. Now, they come in the way of their breathing, where they find it difficult to breathe because there is a physical obstruction to breathing. So they begin to breathe with their mouth open, or they begin to snore. Some children have a little difficulty to swallow because of the physical obstruction. Now, once they develop adenoids and tonsillitis, the following symptoms can happen. Particularly in adenoids, the children, they begin to keep their mouth open. They begin to snore so loudly that not just the room, but sometimes the entire house can hear them snore. They're very restless in their sleep. They don't sleep at one place. They keep moving from one place to the other. Because they are not able to breathe on a straight position, they try to keep their head up. So they try in the middle of the night to come and keep their head on your tummy and sleep, or find an elevated place so that breathing becomes a little easier for them. Now, this snoring is very scary, let me tell you this. They snore very loudly. Now, during the daytime, they might develop frequent colds, frequent cough. Even during the daytime, they might keep their mouth open to breathe. They constantly have some congestion. They constantly have a nasal drainage. They end up in ear problems where they complain of ear pain frequently. They have a nasal voice. They frequently get sore throat. They sometimes, like I said, they have difficulty in sleeping, difficulty in swallowing. Some of the glands in the neck might get swollen. And suddenly they stop breathing in the middle of the night, and then they gasp and then start to breathe back again. Children with tonsillitis, they keep getting infections in the tonsils very frequently, and you have to give them some antibiotic. It gets better. Within a few weeks, they get the infection back again. Now, one of the major things that you need to understand is that these infections which keep coming back in the children happen because of a low immunity. Every time there is an infection, as it is, the adenoids and tonsils are enlarged and it is difficult for them to breathe. Now, when they get an infection, that adds on to the swelling with the discharge or the inflammatory fluid that happens, and they find it more difficult. Now, you go to the doctor, he gives them some medication, they get better, but their immunity is so low that they again get an infection within a few weeks' time. So, the trick is to make sure that they don't fall sick so often. You have to make sure that they don't get these infections very frequently. So, it is very, very important to build up their immunity, and that is what homeopathy does. In the previous days, tonsils and adenoids were surgically removed. But now they recognize the fact that tonsils and adenoids are there with a purpose, to protect. So most of the doctors now don't just remove the tonsils. They try their best to conservatively treat them with either a steroid spray or some other medication. There's a whole lot of information given in Google about what will happen if the tonsils and adenoids are not taken care of. The child will go deaf, they get infection in the brain, the growth will stop. You see, these are very, very few cases which happen like that, and you will know when these cases are headed that way because of the severity of the symptoms. No mother will just ignore a child if this child has got so much severe symptoms. But this does not mean that every child with adenoids will end up in it. So don't worry about it. There are millions and millions of children with adenoids, and they grow out of it over a period of time with or without medication. It is just that they suffer. So you have to give them something to make sure that this suffering ends. And one of the best way that I know is homeopathy. Now, this is a chronic issue. Why is your child suffering with adenoids? Let us look at not just giving some medication to take care of their adenoids. It doesn't work that way. It's a chronic issue. There has to be some lifestyle changes that has to happen. One of the most important things that I suggest for children with adenoids is to balance their 5 elements. You see, if you are 40 plus or 50, all your childhood has been spent outdoors, walking barefoot, working with the sand or soil, mud, being out in the sun, taking bath in the rivers, yelling, shouting. But now the children are deprived of all this. See, these five elements, earth, water, fire, air, and space, are our source of creation. And we have deprived our children with the connect to the source of our creations. We have taken them indoors in search of convenience and comforts. We have taken them indoors. They do not have a connect with the source of creation, and that is one of the reasons so many illnesses are coming today, so many lack of resistance, and so many children falling sick. So it's very, very, very important to connect them to the source of creation and balance the five elements. I've made a comprehensive video on this. Please go through it and make sure that you balance the five elements of your child, not for now, but for a healthy future. This is a gift you can give it to your children by getting them used to balancing the five elements of nature. A lot of people ask me what is the diet that I should give my child because he's got adenoids and tonsils. You see, we are all the time scaring our children about how to fall sick. Don't get wet in the rain, you will fall sick. Don't eat ice cream, you will fall sick. Don't go to somebody who's got a cough, you will fall sick. So we are instilling fear in them. I made a video on instilling fears in children. Please go through that. You will understand the concept and you will stop instilling that fear in your child. If you look at a practical way of life, whether you avoid ice cream, whether you avoid taking them out, whether you avoid giving them sweets, whether you do a diet restrictions, either way the child is falling sick. So why deprive the child of something that he enjoys? I'm not saying go in excess, but you can give them once in a while, whatever. Try not to give too much of restrictions. If it helps, definitely you should do it. But over the next 3 months, if you see that you have avoided so many things, but it has not helped your child, obviously it makes no sense to continue avoiding those things for your children. So use your intelligence and work on the diet aspect of the child. What can homeopathy do? We have treated thousands and thousands of children with adenoids and tonsillitis. So removing the tonsils and adenoids are just removing the effect, not the cause. The cause is a tendency for formation of this glandular tissue. And homeopathy has got wonderful medicines to take care of these tendencies. So taking homeopathic medications not only helps in taking the tendency, but homeopathy is one of the only systems that I know of which improves the immunity of the child. Improving the immunity of the child will make sure that the child is not falling sick very frequently. If the child does not fall sick very frequently, there is less activity at the site of the tonsils and adenoids. And if there is less activity at the site of the tonsils and adenoids, slowly the swelling and the inflammation of the adenoids and tonsils will come down. Now, how do you know if these medicines are affecting? Within a few weeks, you will notice that the child is able to sleep better. Not snoring as much, the intensity of the snoring will come down. The frequency at which he is falling sick will come down, and he will maintain a normal health for a longer period of time. This means that the medicines are working. There is no need for you to go in and get an X-ray and check. If your child is symptomatically improving, the medicines are working, just keep it going. How long? We do not know. Some children respond within 3 months, 4 months, 6 months, 8 months. Some children take more than a year to develop. But what is the problem? We are at least avoiding a surgery and your child is keeping good health. So keep continuing the medications. Now treat your child for his adenoids and tonsillitis holistically with homeopathy. Take care.